Welcome on this second class of the master class on interdental attachment gain. And now we have seen an introduction, and now we start to classify the different type of defects. And let's consider when there is no bone loss, interdental bone loss. I mean, there is an horizontal bone loss. Again, I told you that we have this paper with these co-workers on the interproximal attachment gain, and is published on Journal Periodontology in 2021. And one of the cases published in this journal is a case like this, such as this. There is, you see, a connective tissue graft buccal, pretty extensive, and this was the healing and was not considered acceptable for the interdental problem. So now, as a second procedure, has been placed like a wedge of connective tissue between the teeth and advanced coronal, and this was the final results with the final crown. Okay. And this is another of the cases. This is a minor papilla loss, but for some patient is a big issue. And this with injection of fibroblast, growth fibroblast, they were able to close this papilla. Always to respect the healing time, of course, to diagnose and classify correctly the disease, to try to understand when it's time to work on the bone, when it's time to work on the soft tissue, and to understand what type of disease is. And analyze each case and customize the treatment. Unfortunately, I can only give you this thinking process. I cannot tell you, and I can tell you in this case you can do like this, but I don't know if you have this similar case. You understand? Each case is different. I cannot say apply this technique in each patient. In this patient, worked very well, but because there was good biological approach, no inflammation, good surgical techniques, and good biomaterials, a proper time of healing. And also the orthodontic was done at the end, was all the regeneration maturation were already completed. So respecting all the steps, we achieved a good result. And even though we had some problems, like for example, don't remove the composite before. So every time there is something to improve for everybody. So thank you very much, and see you on the next lecture on this osteocom masterclass. Bye.